Good morning. Welcome to the Point. This past week started out with a full focus on the Michigan primary, but it quickly shifted focus to the coronavirus after cases were reported in the state. This morning, we'll try to talk about both issues, starting with that big Michigan primary. It was the first time that there was more or less a head-to-head battle between Bernie Sanders and Joe Biden. Biden, as you know, was the victor. We talked with both of the candidates before the vote. Mr. Vice President, you came here to talk about health care. Interestingly, on the same day, we released a poll that shows that 50% of voters that will vote in the primary on Tuesday prefer the expansion of Obamacare, preferred to only about 21% who want Medicare for all. So tell me how that expansion would look and what that means overall.
We'd do two things. Number one, I'd restore all the cuts to Obamacare, further subsidize it so people get the better plan for less money, and I would put in a public option that provided for Medicaid like coverage, but it's a Medicare coverage. So anyone who qualified for Medicaid would automatically be able to have the Medicare coverage under our plan. But it's by choice. In addition to that, it would significantly lower drug prices, not allow drug companies to increase the price of a drug beyond the cost of inflation, and it would lower, there'd be no hidden bills, etc. So there's a lot it does, and it can do it quickly, and I think the reason why people like what's happened is we're already, we're covering people with pre-existing conditions. We've expanded coverage across the board, and people need the help now, not a promise in the future that somehow we're going to find $35 trillion to come up with a plan.
Speaking of healthcare, for the first time in 30 years, you and I didn't shake hands when you walked in today because we're all very aware of the coronavirus. We know that it's not just a health issue, but it's an economic issue as the markets were paused for 15 minutes today. What would a President Biden be doing about the coronavirus?
Well, first of all, I wouldn't have done what the president did in the first place and dismantle what President Obama and I put in place in terms of dealing with the diseases, a pandemic disease in office we set up, et cetera, wouldn't cut the budget, et cetera. But it's a matter of competence and confidence. The fact of the matter is the president there's no confidence that people have in whatever he says. He shows up at the CDC and says, perfect, the tests are perfect, and just like my call to the Ukrainian president. And today I'm told he said, he just compared this to the flu, nothing to worry about, everything's going to be okay. I wish he'd be quiet and let the experts deal with this. Let the CDC speak to this. Secondly, the ability to be able to prepare for the testing as well as the care for people who are test positive. Hospitals aren't ready across the country. They need everything from equipment to training to beds and the like. And there's so much we should be doing now in terms of planning, because I'm not trying to panic people, but it is spreading, and we can deal with it if, in fact, we move in the direction that has been recommended by the experts from the beginning. And so I just think the way the president's going about this is all the wrong way.
Quickly moving to another subject that is very important in Michigan, as you well know, and that's trade. There was NAFTA, now there's USMCA. Yeah. Your opponent's been talking about that too. What did trade look like in a state like Michigan to protect both manufacturing and agriculture interests?
Well, first of all, remember, I'm the guy that helped bail out the automobile industry, the single biggest issue that affected the people of the state of Michigan, number one. And my friend voted against that. Okay. Number two, I think the trade policy we have now is a mistaken policy of taking on China on matters that have a negative impact on both agriculture and on manufacturing. We're focusing on the wrong things with China. Number three, we can't deal with China being the rogue nation out there unless we bring in our allies and friends who are the same democracies we have to make up 50% of the world's economy, and make it clear that any agreement that has to go through all of us, we're all there. In addition to that, there's not going to be a single trade agreement that I'm going to sign as President of the United States that doesn't have labor and environmentalists at the table. And so it's a very different approach than I think that Bernie is talking about. But he loves to pick on this issue. And, the problem is the vast majority of the market's out there. We should train our people to be the best competitors in the world, and that's what creates jobs as well.
After the former vice president won big in Michigan, the question was, would Bernie Sanders continue? He answered that question the next day. He is still in the race. In fact, there's a debate later today. Here's what he had to say about his campaign. Senator, everybody wants to talk about the horse race. I'd like to talk about something else. I would like to talk about the underlying importance of this election and the difference in ideas. Let's start with healthcare. The difference between you and the vice president is considerable. So explain to me what Medicare for All looks like for people who today don't have coverage or insufficient coverage, and for people who have coverage that they like that would potentially go away.
Good. Thanks for the question. Look, in my view, the current healthcare system is extraordinarily wasteful and dysfunctional. We are spending twice as much per person on healthcare as the people of Canada or any other European country, $11,000 a person. And yet we have 87 million Americans who are uninsured or are underinsured. We have 30,000 people who die each year. 500,000 people go bankrupt because of medically related bills. And on top of that, we pay by far the highest prices in the world for prescription drugs. All so that the healthcare industry last year could make $100 billion in profits. All right, what Medicare for All is about is expanding a very popular program called Medicare. But today you have to be 65 or older to get into Medicare. All I want to do over a 4-year period is go from 65 now to 55, 45, 35. Everybody is in. And for the average worker in America, that family, they will pay substantially less for health care than they're paying right now. Now the average family is paying about $12,000 a year because we have to administer thousands of separate plans. You have one plan, he has one plan, I have one plan. It costs hundreds of billions of dollars to administer that Byzantine system. When you have one broad system of comprehensive health care for all, it's with you for your whole life. You quit your job, you get fired, you want to start your own business, you have health care as a right. That's what we've got to do.
There are concerns on the part of some people that if healthcare is all in one pot and if it's administered by the government, will your care be throttled? For example, will there be a lack of services available if it's all in one place?
Well, let's be clear. This is not, quote unquote, a government-run healthcare plan. All it is, you'll still go to your same doctor. You'll go to your same hospital. The only difference is, like people on Medicare right now, you will have a Medicare card. It will be for everybody in this country. But you still go to the same doctor, you go to the same hospital. And what we want to do, by the way, is expand Medicare to cover dental care, which is not covered right now, hearing aids, eyeglasses, and home health care, which is terribly important for a lot of folks.
I want to move on, but I have to ask the question that you've been asked 110 times during the campaign. How do you pay for that?
Okay, well, in terms of health care, right now, we are paying for it because we're spending twice as much per capita. You're paying, the average person is paying about $12,000 a year. Their employer is paying $14,000 a year. We get rid of all that. No more premiums, no more co-payments, no more deductibles, no more out-of-pocket expenses. What we do is say to you, hey, it's not free. Of course you're going to have to pay for it. But among other things, if you're an average worker, it's a 4% tax on your income with a $29,000 deduction. All right, so you exclude the first $29,000. That means the average worker in America pays a lot more. We have a tax on wealth, which helps pay for that, and employers will probably have a payroll tax. So we pay for it, but at the end of the day, employers will pay less, workers will pay less, and it will be comprehensive health care to be with you for your whole life.
Let's move on to trade. NAFTA has been an area that you've been critical for the former vice president. There's now the new USMCA. Michigan is disproportionately impacted, it seems, by trade deals. And it's not just manufacturing. I think people forget that we are the second largest producer of specialty crops, second only to California. So we have a big agriculture component too. So any trade deal has to work both well for both. How would a Sanders administration approach that?
One of the differences, as you indicated, between Vice President Biden and myself is our record on trade. I understood way back in the 1990s as a member of Congress that it was wrong to ask American workers who were making decent wages in manufacturing, for example, to be competing against people in Mexico and later in China who were making starvation wages, pennies an hour. I knew that that would fail. And the result was that we have lost over 4 million good-paying jobs. Here in Michigan, NAFTA and PNTR with China cost this state about 160,000 good-paying jobs. Lowered wages caused a race to the bottom. So to answer your question, trade is a good thing, but it's got to work for working people, not just for the CEOs of large corporations. What we will do is bring the unions, and I've worked closely with unions my whole life, into the process, family farmers into the process, and create a system that works for them, not just for huge profits for for the CEOs of corporations.
You talk about jobs. One of the big pushes has been for more skilled trades, and I know you have worked with unions, and they have set up training plants and employed them for a very long time.
Absolutely.
How important is it for the federal government to support the efforts, not only for college education that you've talked about, reducing costs, doing away with student debt, but also making sure that the skilled trades are included?
Enormously important. And when I talk about making public colleges and universities tuition free, I also talk about making trade schools tuition free. There are millions of good paying jobs out there, especially if we're going to invest in rebuilding our infrastructure, if we're going to invest in transforming our energy system away from fossil fuel to combat climate change. We need skilled workers. We need carpenters, we need sheet metal workers, we need welders, we need skilled workers. And I want everybody in this country, regardless of their income, to be able to get that training. Unions do a great job in terms of these apprenticeship programs, which are enormously important. We have to greatly expand them.
So now the primary race moves on to Ohio, Illinois, Arizona, and most important, Florida. The question is, will Senator Sanders be able to rebound in any of those states? And will the former vice president be able to continue his momentum? Something we'll be watching as the weeks move forward. Coming up next, the response to the coronavirus here in the state of Michigan. To the point. Welcome back to the Point. This past week, the first cases of coronavirus were reported here in the state of Michigan. State government is already taking action, trying to get in front of this problem. We talked with State Representative Mark Huizenga. He's an appropriator who talks about money that is now being put forward to help fight coronavirus. Representative, in some ways, the focus of this interview has changed even since I set this up with your office, because you've been working on a supplemental that deals with a lot of things. We'll hope to get to most of that. But one of the things it deals with is with some, I won't call it emergency, but supplemental funding for coronavirus and some of the mitigation that may go along with that. Tell me a little bit about how that came about and what those funds could be used for.
Well, as you said, this has been something that's been emerging at a very rapid pace. In the supplemental, there's $10 million that's set aside, an additional $15 million that's out there. The first $10 million gives latitude to state departments to act proactively, to get out there in front of a situation. I think our goal here is to make sure that the departments have the resources to handle the situation and crisis as it continues to occur and emerge, but to be proactive and make sure that we don't create panics about things. And we're just trying to be proactive. The second $15 million is out there, but would require additional scrutiny to ensure that it's being used probably a little bit more deliberately. But we wanted to make sure that we're ready for everything.
Well, the governor set up task forces to start taking a look at the different elements of this. And we know, as you say, it's emerging. We don't know what it really means. But at some point, this does become a government issue because it's going to impact the entire state. There'll be federal funds, no doubt, that will be backfilling as well. But in the initial sense, this money is just pretty broad latitude, right?
Yeah, that's right.
So this can be used for all the HHS and any of the other agencies that
Yeah, I mean, if I were to guess, I'd probably say, and this is conjecture on my part, but likely this would be used for laboratory testing, the virologist, epidemiologist, different studies, and ways to be engaging with the community. Probably see some dollars go to community health departments and help them to understand how to prepare for this. And again, for the state to take a proactive stance, I think is important. It's important for residents to know that we're being proactive and trying to mitigate crises as they occur.
One of the real concerns is about gatherings and everything from sporting events. The governor suggested that maybe gatherings over 100 should be limited. You got 110 plus staff every Tuesday, Wednesday, Thursday over here. Has there been any consideration, any talk about the ongoing operations of state government or of the legislature? I know it's early, It's all conjecture, and a lot of people are trying to just find a path to figure out what this all means. But as it does develop, and as it does develop quickly, I assume there's been some talk.
Yeah, and as things unfold, I'm sure that we'll take a very deliberate approach for it. But for right now, we have a job to do. We're still working on the budget. There's lots to do there, but also proactive. Our leadership has met with us and said, encourage hand washing. Yesterday when I got to my desk, there was a little bottle of hand sanitizer there. And I think everyone's being cautious, but we also have a job to do, and we'll continue to do that job. When
you talk about doing the job, part of that is doing a budget that will need to be done by July 1st, new laws that you imposed upon yourselves after last year having a little trouble coming to an agreement with the governor. But there's this supplemental that is still taking care of some of the vetoes from last year, and also there's some new initiatives in there. So let's talk about it. It's $180 million that is passed through the House in a bipartisan way that will deal with a number of things. We talked about the coronavirus money, but there's a lot more in there. What else are you dealing with in that supplemental that you think is important?
You know, a couple of things that are really important, not only to my district, but to the entire state, is Going Pro, a very strong program that helps bring training to people that have needs for additional skills. It's something that's widely endorsed by the Detroit Chamber, the Grand Rapids Chamber. I actually heard proactively from a resident just a couple months ago about how important it was to their little tool and die shop about getting their employees new training and credentials, and there's $15 million in there for that. New program the governor talked about at our State of the State last year, the Reconnect program. Those dollars in there too, $35 million. We'll see where that goes, but I think that also is a program where it's going to help those that are more vulnerable get education. I think part of the issue is that sometimes people think of just the free college, but it's about defining what college is. It gives them new skills, certifications, and the ability to create upward mobility. Improving the labor force in the state of Michigan is important. Employers are clamoring for new employees and with those with skills. And so this is an important program that raises all the votes.
And both of those programs are designed, and I think it's important that we point this out, that you're going to take existing workers, people who are perhaps already in the workforce or people who need to be retrained to get back into the workforce, because the number of jobs that are available in the state of Michigan that goes well into the hundreds of thousands of jobs that may be available out there in the coming months and years aren't necessarily going to be filled by a big influx of people coming into the state, but rather both of these things would help existing workers or people in the state now, right?
Yeah, that's right. And I think especially if you think of the small business owners, if they lose an employee, that's a big deal from a percentage of their workforce. Obviously, it's very impactful. But if we can help them to retain those people, it stabilizes their workforce, allows them to continue to fulfill orders. That's good for the economy. That's good for everybody.
When you talk about this supplemental spending, there are those kind of events, but there was one of the big unfunded programs in the state of Michigan is Pure Michigan. And that has been a subject of a lot of conversation. There are a couple of schools of thoughts about how that money is used, either driving tourism. Some have suggested from the legislature that perhaps the tourism industry itself should step up and do more of that type of thing. But at least for now, part of that money for Pure Michigan has been restored.
Yeah, you know, we were at that conference just a few weeks ago where we talked and we heard directly from stakeholders about the value of Pure Michigan. Seeing those dollars restored is going to help everybody as well. Michigan does have a big tourism industry. We're about halfway through the budget right now as it is anyway, so seeing it halved at least gives us dollars moving forward so we can continue to see promotion of Michigan. It's not just in Michigan, we promote it across the globe. The real question now is how is the tourism industry going to handle the coronavirus? And the answer is we'll see.
Well, and that's a very good point, because travel, we already know there are travel restrictions and could be more, but the question of how that impacts travel even domestically could have a big impact on the economy of Michigan.
Pure Michigan is more of an awareness campaign though, and it's not like it's a trigger every time. So it's more about how we continue to promote the state as a positive impact. And I think if you think about the long term, coronavirus will pass, and we still need those tourists to come to Michigan and to see us as a great place. We're the Great Lakes state.
So while you're working on this supplemental that deals with some of the new initiatives you talked about, some job training, Pure Michigan, other things, $180 million worth, there's another $60 billion you have to deal with for a budget for next year, and you're working on it that at the same time. Tell me where you are with that process.
Well, so I chair the general government budget, which includes basically all aspects of the government, from the Treasury to Secretary of State to the Attorney General to the Legislature. Includes MEDC, Pure Michigan, and all those aspects. We continue to work very hard. Long days right now. We're going through the budget. We're meeting with stakeholders. We're meeting with our fiscal staff and our policy staff, and we'll continue to craft that. Our goal is to have it done not only on time, but before that July 1 date. And I think we'll have a good, solid budget. This year's process should be much better than last year's. It was a new governor last year, lots of new legislators, but I have the sense that her presentation, her recommendations put us in a good position to be able to complete it on time.
One of the reasons that this process may go easier is because the governor went on her own to get money, to bond for money for roads, for at least the state trunk lines, but there still is a concern. There is an issue of fixing the roads in your neighborhood and my neighborhood. And so for counties and cities and townships and that type of thing, what does that process and or progress look like? Is there going to be money in that budget? I mean, if you were going to guess, I know it's not done.
Well, one of the aspects is revenue sharing. Revenue sharing goes to our local communities, and having been a mayor, it's always my goal to continue to increase those revenue sharing dollars. That's where local roads come from, and the governor's bonding. It's not a direction I would have gone. Don't really support it, but that's outside of our control. But what revenue sharing does is it increases dollars to our local communities, and our residents drive on roads that are local, state, county. They don't know the difference, nor should they pay attention to that. So as long as we continue to fund those things, increase dollars towards our locals, that should help that as well. And that's my commitment, to make sure that we can continue to fund that.
So you said you think the process will go easier this year because everybody's got a little experience. You know each other a little better, and that makes sense. But talk to me a little bit about the overall atmosphere or relationship, because we know what it looked like when the governor went in with her veto pen, and then she went over to the administrative board and changed the budget that the legislature had passed out considerably. And I know there were those in the legislature that weren't very happy about that. The governor wasn't very happy about the budget she got. So after that's all done, and now a few months down the road, here you are, the legislature and the governor. I presume that there's been some negotiation or conversation with the administration about this supplemental bill. If it passes the Senate and if she signs off on that, what does that say about that working relationship, and how does that play into the next year's budget?
Well, let's be clear. Last year was a tough year. Her request included revenue that wasn't there. As an appropriator, we can't spend money that's not there. So that inherently put us at risk and at odds right from the onset. So we can't spend that money. Realistically, 147 line item vetoes, that's very difficult for us to deal with, because she frankly played petty partisan politics, and it's not appropriate for us to use those in most vulnerable groups to weaponize her process. There's still mistrust. How do we know that the budget that we put through this year won't have line item vetoes? We don't. But I think that the budget's a little bit more benign this year, and I expect that we will be able to get through that. We'll work together. Just as you noted, the supplemental went through on a very strong bipartisan fashion. We'll continue to work well together. I think, at least in the House, I believe the Senate will as well. And if the governor's obviously been part of that, it's the three legs of the stool. It's the governor, the House, and the Senate. So I'm optimistic.
You said you hoped you could get this budget done before the July 1st deadline. So are we looking sometime in early June, or is it just a guess?
Well, it'd be just a guess at this point in time. I'd guess late to mid-June.
Even as we were speaking with the representative, the state Senate took action on that very same supplemental. It will now be headed to the governor. We'll be back with more To the Point. So now the primary has moved out of Michigan, but the question remains, will it be a battleground state in November? The answer is almost certainly yes, with both Republicans and Democrats anxious to claim this territory for their own. In the meantime, the focus will be on the coronavirus. How will it spread? What will the government do to react? And just exactly how will it impact the economy? Those are things that we'll be following for the next several weeks, perhaps months. We'll update you every Sunday morning right here when you join us for To the Point.